Welcome everybody. We're going to get started. This is our, I can't remember. I think this is our second Zoom into Advocacy meeting where we decided to make it easier for our businesses and people who are busy to turn these into virtual meetings. So these will be virtual meetings from here on out, or we're going to test it out for a while versus in our in-person Legislative Action Committee meetings. I want to do some introductions so that we all get to know who's with us today. So feel free. I'm going to just call you out and then introduce yourself, share where you're from. Daniel, we'll start with you.
Hey, so I'm Daniel Inns. I am the Government and Community Relations Manager for Kaiser Permanente, San Bernardino County.
Jeff.
Good afternoon, Jeff, board member with the Chino Valley Chamber of Commerce.
And I will share that both Daniel and Jeff are our co-legislative action committee chairs. So thank you both for agreeing to do that. Newton.
Morning, everybody. How you guys doing? My name is Newton Viengkhou. I'm with Assemblymember Phillip Chen.
Hope.
Morning, everyone. I am Hope Christman. I am the local government liaison with the California Public Utilities Commission.
Rhonda.
Hello, everyone. Rhonda Brogdon with a local business here, ServPro Team Brogdon. I'm also a governing board member of the Chino Valley Chamber.
Jim.
Jim Gallagher, also on the board of directors of the Chino Valley Chamber.
Heather.
Hi, everybody. My name is Heather Parsons. I'm the director of the Chapey College Foundation and also a member of the board of directors for the Chino Valley Chamber of Commerce. Good to see you all.
Daphne.
Hi, everyone. I'm Daphne Lezo Duran with Assemblymember Freddie Rodriguez, and I cover the city of Chino and Upland.
Excellent. Braxton.
Howdy there, folks. My name is Braxton Difuntorum, and I'm a field representative for State Senator Kelly Seyarto.
Jacob.
Hi, everyone. Jacob Jauregui. I'm with Hilltop Public Solutions, a part of the Yes on Prop 1 campaign.
John.
I'm John Dean with Congresswoman Young Kim.
Jim Maloney.
Hello, can you hear me, Zach?
Yes.
Yes, I am Jim Maloney, Transamerica Financial Advisors. I'm a member of the chamber.
And then Luis.
Hello, Luis Satina with the Metropolitan Water District.
Okay, well, great. Well, thank you. Thank you all very much. We're gonna run through our agenda today. So first off, we wanted to actually hold on one second. Okay, we're going to start with Jacob. So Jacob's, he's going to give us a presentation on Prop 1, treatment. So Jacob, go right ahead.
Awesome. Is it possible for me to share my screen? I have a presentation.
Yes. There you go. You should be good to go.
Excellent. Here we go. Can everyone see my screen?
Yes.
Perfect. Good afternoon, everyone. Again, my name is Jacob Jauregui. I'm with the Yes on Prop 1 campaign, and I'm here today to provide an overview on Prop 1 and hopefully earn your endorsement as we lead up to the primary election. Just for some context, last summer, this bond initiative and mental health reforms were unanimously passed out of the legislature and placed on the March 2024 ballot. And I'm just going to move on. So why does California need Prop 1? Well, for the first time in decades, Californians will have the ability to transform the state's mental health system, modernizing it to meet the needs of all Californians. And we know that mental health treatment has been underfunded for decades, and the COVID pandemic only has made things worse. And Prop 1 will refocus billions of dollars to serve tens of thousands of Californians, including the 2 out of 3 homeless people that have active symptoms of mental health illness, and those living in encampments or suffering the worst substance use issues. And so what Prop 1 does, essentially 6 major things: expands community-based services. It will build supportive housing. Tied to that is the construction of building over 11,000 supportive housing settings for those dealing with the severest mental health issues, as well as substance use. Provide treatment over incarceration. We are spending over $100,000, and these are specific instances where individuals have mental health issues, are a danger to themselves and others, and the law enforcement is forced to rather than get these folks the help they need, they will of course send them to jail and go through the whole process. And so this creates an alternative where these people are able to get the help they need and less burden our prison and jail systems. It also will help homeless veterans by providing $1 billion to serve veterans experiencing homelessness, mental health, and substance use issues. Addresses the shortage of mental health workers that our state is in dire need of. And there are strict accountability measures built into Prop 1, which will provide oversight on this. In terms of the funding, 90% of funds from Prop 1, which essentially reprioritizes a funding source from 2004, which is Prop 63, I believe, and it's the Mental Health Service Act that was passed, that passed a tax over $1 million of income, and that funding source has been in place since 2004 and will continue to be in place. This reprioritizes that funding without creating new taxes and essentially refocuses to address what is needed now. And so 90% of the new funding model includes those allocated to counties. 30% of that will be, they will be required to go towards housing interventions for children, families, youth, adults, and older adults living with serious mental illness, as well as emotional disturbance or substance use disorders. 35% of that should be allocated to full service partnerships. These are one of the most effective models of comprehensive and intensive care for people at any age with the most complex needs, whatever it takes models as it is called. These funds will be used to expand the number of FSP slots across the state and are key to the implementation of Care Court. And then 35% will be allocated towards behavioral health services and support, so early intervention, outreach engagement, workforce education and training, capital facilities, and so on. And then counties will have the flexibility to move up to 7% from one category into another, up to 14%. We know that counties have different needs based on what they are. LA County's needs are not the same as San Bernardino's, or not the same as San Francisco's, and so on and so on. And so counties will be able to play around or move around the funding to match whatever needs are most pressing for that county. The remaining 10% will be for statewide, state-led investments. So 4% of that will be for prevention through population-based programming. These just help essentially make the state's residents aware of programs and programs that are available to prevent someone from falling into homelessness or getting the resources they need to get mental health or substance use disorder treatment. The 3% remaining will be used towards workforce development. So this is going back to workforce, expanding the mental health workforce in the state. So culturally competent and well-trained behavioral health workforce to address our statewide need and leverage those dollars to draw upon additional federal funding that will benefit the entire state with a $2.4 billion investment over 5 years. Then the remaining percent will go to statewide oversight and monitoring, which is about developing state outcomes, conducting oversight of county outcomes, training and providing technical assistance, research and evaluating, and administering programs. And just one key component to be aware of this is that in the existing Mental Health Service Act, which is what's already in place that would be reprioritized, there is a commission that oversees how that funding is spent. And so that commission would roll over into Prop 1, the new funding model, and they would have the authority to provide oversight on this. So that's an independent commission that is, it's almost like a state agency in a sense. And so they'll make sure that counties are spending the money appropriately and allocating those resources accordingly. So in terms of our coalition, it is very diverse and quite broad. We've made sure to reach out to organizations and elected officials across the spectrum, ranging from business advocacy organizations like the California Chamber of Commerce, LA County BizFed, and other quite a lot of other business advocacy organizations like the LA Chamber, and as well as labor. So one of the biggest proponents of this measure is the California Professional Firefighters Association, which has been pushing this, as well as law enforcement associations. We're working closely with these partners to get information out on Prop 1 and the approaching election. And some of our elected officials include, sheriffs, as well as some of the big city mayors and county officials, as well as state representatives. So it's a very diverse coalition. And we also have health and mental health providers. So Kaiser Permanente, which is a huge supporter, as well as NAMI, Sutter Health, California Hospital Association, and so on. In terms of the initial polling, it came, what the polling showed was that 68% of likely voters are likely to vote yes on Proposition 1. So we're confident about that polling, but we're not taking any chances. And so that's why we're doing such extensive outreach to not only to voters, but also to organizations that have members that can get the word out, which is a key component of our outreach. And so this is just an example of some of the supporter message that have resonated. And so we are continuing to promote Prop 1 using not only this, but we also have additional polling tested messaging that is key to reaching voters. And so in terms of our major campaign updates, as you can see, the primary election has been moved up from June to March 5th, and we are less than a month and a half from the election day, as well as I believe about a week and a half from ballots being dropped. So everything is sped up, and we're zooming to the March 5th election with paid media campaign starting this week, as well as TV ads running in major markets the week of February 13th, leading to the GOTV, or Get Out the Vote, week for the campaign, which is going to be pivotal. And sprinkled throughout this, and not only GOTV, are in-person events that Prop 1 is hosting, again, to reach voters and make sure the word is out on what Prop 1 is and that they should support it. And so just to sum it up again, Prop 1 is a critically needed set of mental health reforms and bond initiatives that will modernize the way California works to help the most vulnerable among us. 1 in 3 California prisoners is diagnosed with mental illness, but we know from research that this is costly and effective solution, and Prop 1 will help prioritize treatment for the mentally ill and not punish them. And so just an example of how we're engaging our coalition partners on social media, as well as through those in-person events. So that is my general overview. I'm happy to answer any questions, and thank you again for the opportunity to present on this.
All right, let's open up for questions. Daniel, I saw you pointing up your finger.
I just mainly had more of a comment too, and kind of explain why Kaiser Permanente is such a strong supporter of Prop 1, and it really has to do a lot with the fact that these folks basically have 2 places to go if police pick them up, and it's generally the hospital or to prison or to jail, right? And so our 3 largest mental institutions in the United States are all jails, right? We have in Los Angeles, that's the largest in the United States, and then the second largest is in Chicago, and the third largest is Rikers in New York, and they're all prisons. When they do come to us, they generally, the officers would like us to hold them on a 5150 hold. And so what ends up happening is we're only able to keep them for a few days. and we check them out and we give them the health care that they need. But at the end of the day, what's really wrong is for a lot of folks with mental health issues is in their mind, right? Like that's not something that you can fix in a matter of days, weeks. That takes years, right, for these folks to rehabilitate themselves. And so, and on top of it, it also fills our emergency rooms up with folks that at the end of the day, we're really not going to be able to help too much. We're going to be able to hold them for a few days, and then we end up having to send them back out. And so, Prop 1 is going to really help with some of those issues. Instead of coming to the hospitals, instead of going into the prisons, they're going to have another location to go. And so that's kind of one of the reasons why Kaiser Permanente is a real big supporter of Prop 1.
Excellent. Thank you, Daniel. Jim.
Thank you for presenting this. For the last 10% that you noted, you had a 3%. You were talking about oversight.
Yes.
People, is there any detail on what the oversight committees would look like or who would compose them?
Yeah, so the existing Mental Health Services Oversight and Accountability Commission, which was again created in 2004 to provide oversight on the funding that is already being distributed to counties and that would be reprioritized. Their Prop 1 would increase the scope of the advisory review to include all behavioral health funding. So mirroring the county integrated plans and reports, continuing its status as an independent agent, and then adding additional community representation, namely for transition age youth and for individuals who are aging or disabled and other critical perspectives, and funding a $20 million innovation fund. So that commission is going to have oversight on how this funding is distributed, as well as that funding, that $20 million fund.
Okay. No, thank you. Appreciate it.
Absolutely.
Any other comments or questions? All right. Well, Jacob, thank you very much for coming and sharing that with us today. And Daniel, thank you for organizing that for us. I also want to, I didn't mention this earlier, but Julia is here next to me. She is the one that helps organize our Legislative Action Committee as well. So we are both here in the office working on this. So now we're going to go on to the next phase of our programming, which is updates from our elected officials. So John from Congresswoman Young Kim's office, we would love to hear some updates.
We didn't have much to update. I will provide a list of the legislation we have. I'm sick at home, so I don't have it on hand. So, but I'll make sure I provide to the chamber.
Okay, well, thanks for coming and feel better. Rest up. From Senator Kelly Seyarto's office, Braxton.
Hi there, folks. So with the start of the legislative session for this year, there's been several bills that the senator has been able to introduce. With it being still early on, there's still going to be a couple more bills that will be coming down our pipeline as these weeks and months pass. We have, I'm just going to say one sentence on the 6 bills that we currently have numbers for. Is that okay?
Yeah.
All right. So for Senate SB, so that stands for Senate Bill 911, that is the Survivor Benefits Tax Exemption Bill that we have, which will make the first $20,000 of payments from the survivor benefits plans tax-free within California. So that is Senate Bill 911. Senate Bill 916 is the California Veteran Fee Waiver Bill that will be extending the California Veteran Fee Waiver to also include extended education courses that fulfill an undergrad degree program within California public universities. That is Senate Bill 916. Senate Bill 920 is the Purple Star School Program, which will codify the Purple Star School Program that is currently being administered by the Department of Education within California. That is Senate Bill 920. Senate Bill 932 is the DMV Hold Harmless Protections Bill. And that will modify the California Hold Harmless Protections legislation in place for private automobile sales. This will establish protections for a new owner of a used vehicle from any past registration fees and penalties carried by the previous owner. That is Senate Bill 932. Just two more. Senate Bill 936 is the Every Death Counts Bill, which will require the California Department of Transportation, Caltrans, to use available collision data when prioritizing road projects, infrastructure improvements, improvements or developments on the state highway system. That is Senate Bill 936. And lastly, Senate Bill 955 is infrastructure gap funding that will help cities and counties complete vital infrastructure projects by creating a new grant that the legislature will fund from year to year. So that is Senate Bill 955. If there's any questions on those bills, I am happy to try my best to answer those. Otherwise, I'm sure I'll have more updates as these weeks and months pass. That is very much it for me.
Okay, excellent. Heather.
Thank you so much for that update. For Senate Bill 916, the Cal Veterans Fee Waiver Bill, does that also apply to California community colleges?
I have it as, according to what it's being written as right now, for the as long as the veteran meets certain qualifications, the spouse and children of that veteran, upon acceptance, in addition, can attend any California State University or University of California school with no tuition, registration fees, or enrollment fees. So that does not specifically mention the community colleges within the state.
Okay, thank you so much.
Thank you.
Okay. Let's see. Next up, we have Assemblymember Phillip Chen's office, Newton.
Morning, everyone. In terms of legislation, with the start of the new year, I know different bills have been being brought up. As of right now, Phil hasn't made any official stance on any. We're still trying to gather more information and listen to different parties and different ideas. I was really excited about this meeting though, because our constituents, it's pretty 50-50 on Prop 1. So I was definitely hoping to get more insight on what Prop 1 would be about. And I just want to say thank you for all the information today. Thank you.
Excellent. Thank you, Newton. And then from Assemblymember Freddie Rodriguez's office, we have Daphne.
Hello, everyone. Good afternoon. I have a few updates. So this is the Assembly member's last term. He will be terming out. His main focus is emergency management as he is chair, and public safety is another thing he is really focusing on. In regards to legislation, I did want to bring up one bill that passed out of the Public Safety Committee. Actually, since we're talking about healthcare, it's AB 977. This would increase the penalties for an assault or battery committed against a healthcare worker providing emergency service inside the emergency department to be equal to the penalties for an assault or battery committed outside of an emergency department. So basically, for a battery committed to a healthcare worker that's outside, there is a fine up to $2,000 or a 1 year in county jail or both. However, when it comes to inside, there is a lower misdemeanor and fine up to $1,000 and a jail time of 6 months. So the assembly member is looking to make that equal. And then in regards to Chino itself, I did want to share that I know in Chino, they've been talking about the measure about increasing Chino sales taxes. And I wanted to inform you guys that the assembly member did speak with Chief Munson and everyone else, and he does support the measure as well. But if there are any questions and concerns, or if there's any support or oppositions for any bills that do come up, during the floor or anything that's coming up during committees, please let me know. And Seb, I think we spoke before. We left for the holidays, but let me know, or please feel free to give him a call, and he's open to talking about any other bill.
Okay, perfect. All right. So yeah, I mean, on our end, this was I don't want to say a one-off, but we scheduled this one as a special convening because we did want to go over Prop 1. We're getting close to the period of more action from our Legislative Action Committee meeting. But I thought I would open this up and just see if there was anything in particular that anybody in this that is attending today, if you would like us to organize some type of presentation or on some kind of legislative issue that is coming up. Does anybody have anything that is on the horizon that they feel like they would love to see some more information on moving forward? Okay, I'd like to pass it off to Daniel, and I'll start with Daniel. Is there anything, just as our legislative action chair, is there anything you want to share before we adjourn?
No, not right now. Yeah, I think I appreciate everybody coming out and participating in this webinar, or I guess Zoom into advocacy. And thank you all for your time. I think maybe in the future, you had mentioned possible topics, and so there's a lot of issues that us at the hospital, and in particular our workforce, is dealing with, and so would love to maybe do something around workforce development or some type of specifically within healthcare, just because there's such a need within healthcare, and so would love to be able to participate and maybe even collaborate with some of you on opportunities for workforce and workforce pipelines and specifically within healthcare. Thanks.
Thank you. Jeff, co-chair, anything you want to?
No, I just want to say thank you for putting this together. It's always great to get informed on what's going on with a proposition, and especially since the election's been moved up to March, early March, that we can get whatever out there so that people can understand what's going on, not only with this but also other measures that may be on that March ballot.
Thank you. And actually, I'm just going to do a round robin with those of you that are in here. Hope, is there anything you would like to address with the group?
If it's all right, I would like to take a moment to share something that's coming up at the CPUC. On February 7th, we're going to be having a webinar for nonprofits and tribes. So if you work with any of those, you might want to share the information that we will be having a grant program coming out for clean energy projects. So our webinar is going to be sharing about that grant program that's going to be opening up in the next couple of months. So that'll be on February 7th.
Great. Rhonda.
This was really great. This was my first time attending this Zoom into advocacy. I appreciate all of the information that's been provided, the updates. Interested to hear about the Prop 1. I probably will have some questions, and we'll probably shoot you some questions in an email. Thank you for providing that, and look forward to more.
Excellent. Jim Gallagher.
At this time, thank you.
Luis.
Not much. Just it's always tough to talk about water on a state scale, state level when it's raining outside. So I'll hold my comments when it's a really hot day.
Sounds good. Jim Maloney.
Yeah, I sent you a chat, Zeb. I was just wondering if the chamber is actually endorsing this Prop 1. And then I agree with Jeff. I think we should have some kind of a summary of the propositions that are coming up, if that's possible.
Sure. Yeah, no, thank you for the feedback there. We can definitely do that as a follow-up to this meeting and send out to our membership. And to answer that question, our Legislative Action Committee meets right after this. So you are, as a member, you are more than welcome to participate and give your feedback and opinions on that front right after this. And then lastly, Coach Vito. Coach Vito, introduce yourself first and then share anything you would like to share.
Yes, my name is Coach Vito from Swag Basketball. Swag Basketball's after-school program that's providing physical education through basketball skills training to keep kids active and fit in a safe environment. Based off the meeting, I'm just grateful to be a part of the meeting to learn more about Prop 1 and what the chamber and what's going on in the surrounding communities and how we can continue to collaborate together and how we can improve on workforce and how we can improve in different things that the city needs and how we can provide those needs and work together and help the city, of course, city of Chino and surrounding cities, and how we can continue improving areas.
Okay. Jim, sorry, before we go, Jim.
Yeah, just a quick question. We will have access to this Prop 1 briefing?
Yeah, so I did record it. So my plan was to put it up on YouTube as when I get a chance. So I hope to put this up on YouTube, and I will make sure that that gets sent out in our follow-up email that goes out to our membership.
All right.
Zeb, real quick, I just wanted to ask, is it a possibility if I can, people that I'm new to the Zoom meeting, if I can get people emails just to stay in collaboration with everyone, and it's important during these times. So if people can, during the chat, in the chat, put their emails, I would like to schedule meetings and collab with each and one of you to get more information and learn more about each and one of you. Thank you.
All right. Thank you very much. Okay, well, we're going to move into our closed session period with our Legislative Action Committee meeting. So this is for members of the Chino Valley Chamber of Commerce that are, represent our businesses. So feel free to stick around. We'll get that started maybe like 5 or 10 minutes or so, but it will be on the same Zoom call, and we'll follow up with that meeting to help plan the course of our year for our Legislative Action Committee. Thank you, everybody who made it today. Like I said, feel free to stick around, and thank you to our elected. Can we give a round of applause for our elected reps that made it here today, and for our speaker? Thank you, everybody. We appreciate you. Thank you very much, and hope to see you soon.